Hello friends, welcome to Creative Medicine. In this lecture, we will learn about.
So if you see anticholinergic drugs acting on bladder are solifenacin, we have solifenacin, darifenacin, then we have trospium, then we have tolteridone. All these are anticholinergic drugs. Tolteridine. So all these are used in unstable bladder. This tolteridone is actually the drug of choice for unstable bladder. And one more drug which is approved is we have onabotulinum toxin A. Onabotulinum toxin A will release it is an acetylcholine esterase acetylcholine release inhibitor. It inhibits the release of acetylcholine from the synaptic into the synapse from the presynaptic neuron, and thus this onabotulinum toxin A is used in the treatment of overactive bladder.
Thank you and thank you for watching.